I'm Jennifer, nurse practitioner here at Northeastern Reproductive Medicine and third-party director. I am really excited to present to you sperm donation today. I'm also here with my team of Logan, who's our third-party coordinator, and Jess, who is our egg donor coordinator. Thanks for hopping on. The agenda in this talk, I'll just do my little introduction, which I just did. Who is a good candidate for sperm donation? Timeline, directed sperm donor process, non-directed sperm donor sperm bank option, and then the sperm recipient process. There are many ways to make a family, and sperm donors are an option for all. It's a family build, which is wonderful. Sperm donor is a fertile person who donates their sperm to another individual, who we call a sperm recipient, and it's not the recipient's partner. The sperm donor can be identified or known to the sperm recipient, or a non-identified sperm donor. So that means that the sperm recipient does not know them and they've decided that they want to use their sperm to build their family. A sperm recipient is the person or patient accepting the sperm donor's sperm to build their family. We here at NRM follow the Food and Drug Administration and the American Society for Reproductive Medicine guidelines. These are required for the use of sperm donor. These guidelines are designed to ensure the safety and well-being of all parties involved. While there's no method to completely ensuring that infectious disease agents will not be transmitted from donor to donor recipient through donor insemination, these guidelines combined with information about history of donor should significantly reduce the risks to the individual receiving the sperm. Ideal candidates, who's ideal to be a sperm donor? We like a sperm donor between the ages of 21 and 40. We'd like them to be a non-smoker, physically and mentally healthy, able to report their detailed family history. So is there a family history of different types of cancers? Is there inherited genetic diseases within the family? Birth defects within the family. These are all important information for the sperm donor to disclose, so the sperm recipient understands kind of the DNA makeup of the sperm donor. In order to determine if the donor is a good candidate for the process, we also do some blood work, which we check for genetic carrier screening. This blood test determines if the donor carries any autosomal recessive diseases that could affect a child. Genetic carrier screening does not eliminate all risk of genetic diseases, as we cannot detect all mutations, but it is a great finding, so a sperm recipient understands what kind of genetic carrier screening the donor has. We also do an infectious disease panel, and then a semen analysis, evaluating how well the sperm are moving through the microscope, how many sperm there are, and the morphology, any abnormalities within the sperm themselves. We also do an FDA eligibility screen, which includes a physical exam, a questionnaire, and to ensure that the donor meets the FDA required eligibility to donate. When you're using a direct or known sperm donor, so you have a relationship with them, you and the sperm donor will need to go through a legal agreement. We require that here at NRM. You and the sperm donor check in with legal consultation and develop a written contract. Just so lines are crossed, so you know what's going on in the relationship. We don't need to see that legal agreement. We just need a one-page affidavit to know that it exists. And then sperm donor and sperm recipient will go through psychological consultation. The decision to proceed with sperm donation is complex, and the American Society of Reproductive Medicine recommends a clinical evaluation by a qualified mental health professional to address the several moral, ethical, and emotional and social issues related to the sperm donation process. Separate consultations for the donor and the recipients, as well as a joint session with the donor, is recommended. This is just kind of an overview and a quick timeline of how the process works, because it can all get a little jumbled, and just to kind of understand what it all looks like. You would come to NRM for your initial consultation with the provider, and you would also have a financial navigation appointment. After this, you'll start looking at sperm donors, whether through you're looking at a directed donor through friends or family, or you start looking at sperm banks. And then you'll match with the sperm donor from a bank or the directed sperm donor. Screening takes 1 to 3 months, give or take. We'll then do a workup on the sperm recipient, and that usually takes about a month. We're checking to see how the uterus of the sperm recipient is, the ovarian reserve, things like that. After all of these steps have been done, you'll regroup with your provider to get all of the information in a neat package so you understand how all things look, and then you'll move into treatment to establish a pregnancy. As I kind of mentioned before, directed sperm donor process, the directed sperm donor is a donor that you know or have a relationship with, is a little bit more complex just because there is that known relationship of the sperm recipient knowing the sperm donor, but they're not in a relationship or co-parenting together. They're just kind of using the sperm to create the family. So you would have a telehealth visit with myself. I would go over the screening of the sperm donor, semen analysis, and blood work. I would make sure that the legal agreements are done and that the site visit has been completed. And then once we're ready to freeze the sperm donor sperm for your use in the future, within 7 days, I'll do the FDA history physical, the completion of the FDA eligibility questionnaire, and then the FDA ID labs and infectious disease labs. So we follow the FDA guidelines. We would collect the sperm and freeze the sperm for your future use. And then per ASRM guidelines, the sperm must be quarantined for 35 days before we can release it to use for you. The sperm donor will be retested for the above infectious diseases prior to the use of the sperm. This is to identify any undetected infections at the time of the donation. Current evidence suggests that the chance of having undetected HIV, Hep B, or C 35 days after initial negative test is extremely low, just so that feels good for everyone. Non-directed sperm donors or sperm bank donors, we can accept the shipment of sperm donors only from FDA-approved sperm cryopreservation labs. The screening of donors is performed by this donor sperm lab. So some big ones are Seattle Sperm Bank, Fairfax Bank, California Cryo Bank. They all follow the same FDA guidelines we do here for your directed sperm donor. If you decide you want to use a sperm bank donor, so it's a non-directed or anonymous sperm donor, you would have to go through one of the approved banks that we work with. Those banks would have done the genetic disease screening, so you know any risks that any risks in the genetic testing that the sperm donors have. You would choose the sperm vial selection. You would choose IUI or ICI or ART samples, depending on what treatment cycle you go through. And the success rate per cycle of a donor IUI is approximately 15 to 20% per cycle, which may be lower based on age or specific characteristics of the patient. Most pregnancies occur in the first 6 cycles. Overall success rates are up to 70% after 6 cycles. The person receiving the sperm, a reminder, is called the sperm recipient. Their workup and process is below. We would want to make sure that the uterus is good for pregnancy, so we do a uterine evaluation, which is called a sonohystogram, that evaluates the uterine cavity to ensure no barriers for future pregnancy for the person carrying. We do blood work, prenatal labs, as well as infectious disease labs per ASRM guidelines. Mammograms and EKGs are required for women over 40 who are carrying. And the MFM, or maternal fetal medicine consult, is required for any woman or person interested in using their uterus over the age of 45. These are some sperm banks that I had kind of talked about in the previous slide. Seattle Sperm Bank, New England Cryogenic Center, Fairfax, California Cryo Bank. We will work with any bank that is FDA and CLIA approved. Some banks on this list are not on here, but we work with any that are FDA and CLIA approved. This is just an ending quote. My sense of gratitude to the donors is profound. I don't think of the donors much, but when I do, I move to tears because I wouldn't have these children if it weren't for the gift that the donors gave to me. This was made by an anonymous sperm recipient, so I thought that was a nice ending quote. This is our website, phone number, and address. Thanks so much for hopping on. Bye!